Hello, everyone. You're welcome to another session of A Day with Your Fertility Specialist. My name is Precious Adama, and I'm going to be your host for today. Thank you to all our viewers for always tuning in. Thank you for your likes. Thank you for your comments. Thank you for all the engagements. We really appreciate. On today's episode, we're going to be talking about the fertility conversation that every woman should have before turning 35. I know 35 is quite a notable age in the life of a woman. You often hear things like you should have your children before the age of 35, you should do this before 35. So today we're just going to be delving deep to see what happens to the female reproductive system before and after the age of 35. So stay locked in, don't go anywhere. Do well to repost and invite all your friends and family so they could be part of this knowledge sharing session. To throw more light on this topic, we have with us Dr. Jane. Good afternoon, Dr. Jane.
Good afternoon,
It's a
Precious.
pleasure to have you on set.
Thank you for having me.
Okay, so for those of us joining for the first time, Dr. Jane is a minimal access surgeon. She's a gynecologist and she's also a fertility expert. So feel free to bombard her with all your questions because the answers are here. Welcome, Dr. Jane.
Thank you.
So, starting with the basics, why is 35 often considered an important age during fertility discussions?
Um, 35 is considered important because there is this age-associated fertility decline that happens with both men and women. Now, for women, after 35, it becomes more pronounced, and it's something that becomes very pronounced for the women compared to others. So it's a gradual thing. Even though 35 is a time where there's a significant gradual decline in the fertility, air quality, reserve, and all. But again, that's not to scare us, it's just to create awareness.
Yes.
And also, it's also important to know that some women can also get pregnant and have their children after
The age
35.
of 35. All right. Thank you so much. So, does turning 35 suddenly change fertility or is it like a gradual process?
Well, it's a gradual process. It's something that happens. A lot of women are born with the whole number of eggs they would ever have.
All right.
So, and from 35, you begin to have the decline. So it gradually reduces, but from 35, you notice this decline more.
Okay.
With there's also reduction in quantity and quality.
Quantity and quality of
So
eggs.
you see your counts and the functionality of the egg. So increasing risk of miscarriages, your
Okay.
fertility response or your response. Fertility for younger person and someone over 35 might not be the same. Your pregnancy rate might drop and all of that.
Okay.
Yeah, so that is what changes. As those
Alright.
air quality functions start to drop, also you begin to notice some irregularity with periods and a lot of things start to happen about that time. So it's an important age to discuss a lot of things and also puts your fertility in your future plans too.
Yes. Thank you. So we actually make mention of the word ovarian reserve. Can you throw more like what exactly is the ovarian reserve? Is it just the quality, the quantity of the eggs?
Well, I guess it's the quality and quantity.
Okay.
Yeah, so as I mentioned that every woman is born with the total number of eggs she will ever have. For every month a woman menstruates, she loses some eggs. And remember, you don't reproduce them anymore. So it just keeps dropping. When you have a basket or a pool where you pick out balls from,
Yeah.
it means at some point you have fewer balls compared to when you started the journey.
Yes.
So that's what happens with ovarian reserve. And when quality also drops too, it can affect pregnancy rate, the miscarriage rate, risk of having babies with abnormalities, and all of
Okay.
that. Yes.
So risks of having babies with abnormalities more concerned about like with the quality of the eggs. Right.
Yes, quality of eggs.
Okay. All right. So, why do you believe this conversation is important for women today?
This fertility discussion is very important for women. A lot of women are beginning to make career choices,
Yes.
choices about their education, business, relationships, and even so it's when you are making these discussions, your fertility should also be put in perspective. And this discussion helps you to make informed decision, informed plans, and all of that. There are a lot of things you can do, even if you when you're not ready for a baby yet. But when it's in perspective, so you don't come and at the end of the whole acquisition,
Yes.
then it will now be you looking back, you wished you did that. So the essence of this discussion again is to increase knowledge, awareness, and help women plan their
Their lives.
reproductive path properly.
Okay. All right. So, what are some things every woman should know about her fertility, regardless of whether she's planning to start a family now or in the future?
Everything about her fertility, she should ask questions. You don't have to wait when there's a problem. So you ask question, what are the problems? What can happen? What are the options available for me? What if it goes this way? What if it goes? So a woman should ask all of those questions, and that is where the fertility experts come in.
Okay.
Yes, when a woman is trying for a child, it's not coming, it's a good time to check. But most times at around 29 to early 30s, it's a good
29
time to
early
talk
30s.
about fertility outcomes and plans, because that's a
Okay.
good time also to get knowledge and plan at that point in time. See how we can also get good eggs for future reproductive plans.
Okay. So, can a woman have regular periods and still have fertility challenges?
Yes, a woman can
Mm.
have regular
Regular periods.
periods and also have fertility challenges. Fertility challenge is not just about even though regular periods is a marker of ovulation,
Yes.
but a woman can ovulate regularly, but there are other things that can affect her fertility. A woman can be ovulating and have tubal factor infertility blocked tubes. A woman can be ovulating and have her organs at with scars adhered
Okay.
to themselves from probably endometriosis. There can also be some uterine factors that might affect fertility.
Okay.
Even aside that, the partner's fertility can also affect her fertility. So you are menstruating regularly, but you can have all these problems put together. And
Okay.
those are other things. That's why it might not just be a one problem infertility issue. It can be the problems can be multiple from different points.
All right. All right. So, how does age actually affect the egg quantity and the egg quality?
Yes, so, we had said this earlier, so it's a natural decline. So
Yes.
when a woman already has all what she would need all her lifetime at
Yes,
birth,
and breath.
it means every month. So most women at time of birth, they have like 2 million eggs. So by the time a woman gets to menstruation, when she starts her normal menstruation, a lot of women will be left with 300 to 500,000. So now
Okay.
every month you lose about 25 of those eggs every month.
Okay.
Yes, you ovulate one,
Yes.
then the rest become what I call this a medical term called atretic, like medical death or cellular death, something of that nature. So you
Okay.
lose a lot of them every month. So you keep doing that. They just keep going from the pool, and all of that. So that's what happens naturally with the ovarian reserve and the decline that happens with age. And that is the strongest factor that affects fertility for most women, as alongside all the things we had mentioned.
Oh, all right. All right. Thank you. So, are there warning signs women should pay attention to regarding their reproductive health?
Yes, for most of those conditions that could affect fertility, for a woman that will have irregular periods, heavy periods, painful periods, abnormal discharge, chronic pelvic pain,
Or absence
um,
of the period at
absence
all?
of the period at all, or very increasing size of a mass in the tummy or a growth in the tummy. All
Okay.
of those are abnormalities and they can affect pregnancy in one way a woman's chances of conception and her fertility, one way or the other.
Okay. Oh, that's good to know.
So whenever a woman has any of those, it's an important time to seek
Medical
consult with a
advice.
gynecologist or a fertility specialist so you can chart a way forward to your fertility options.
Okay. So many women today are focused on education, career growth, business, or personal goals. How should fertility fit into these plans that they have?
Just like you listed, so career goals, educational plans, then you just put
Yes.
fertility at the end. You say, yes, your fertility options. So women should also, considering all we've discussed,
Mm.
your fertility is also a sign of your overall health too. So
Yes.
it's something that should be planned. Fertility should be planned. Even if you're not ready for a child at the time, you can plan and prepare for future reproductive career. So
Okay.
it should be part of your plan, not waiting till the end, then wished you had done that earlier.
Hmm. Okay, that's good. So let's say somebody has the plan of getting married at 35. Like you are in school and you've calculated your age. By the time I finish my degree and everything, I'll be 35 and I'm ready to settle down. So I feel like, what kind of advice would you give that person? Should she like freeze her eggs, or she should just wait and try?
Okay.
Uh,
So for a woman planning to get married at 35,
yes.
well, she should stay hopeful. Like
Okay.
I said in the introduction, a lot of women can get pregnant at 35 and have their children and a family from
Mm-hmm.
that point. Yes, but a woman planning to get pregnant at 35, this knowledge session is to create awareness that there are chances that your fertility would decline from that point. Yeah,
Okay.
so the option of egg freezing is there. Not
Yes.
just women that even having educational journeys and all of that. For women too, that are going to be having treatment of one condition or the other that might affect their ovaries and all, like
Okay.
cancers, they can have their eggs frozen to plan for that. But a woman getting married at 35 should stay hopeful. She can get pregnant and have children too at 35
Okay. All
and
right.
even above.
So, what are some of the biggest misconceptions women have about fertility and age, based on your years as a gynecologist and a fertility expert?
Well, common misconceptions. A lot of times people think that because they are menstruating, fertility doesn't change. It remains the same until they are ready.
Yes.
Another misconception, a lot of persons think that fertility treatments can take care of age associated
Okay.
challenges with fertility. So
Okay.
yes, while fertility, okay, not necessarily age associated, it can take care of every fertility challenge. No, while fertility treatment can help, there are also other factors that might impair, like the air quality and all of that, so that women don't stay and say, okay, when I get to 30, 40, yes, I will go for this treatment and get it done. So this is also to let them know that at this point we are having decline in quality, quantity. So you need to freeze your eggs and plan for this time that you want to get pregnant.
Okay. All right. So, how much does lifestyle influence fertility outcomes?
Well, lifestyle is obesity, chronic alcoholism,
Mm.
and chronic stress. All of those can affect fertility through hormonal imbalances, that can lead to irregular periods, absence of ovulation, and all of those. Even some chronic health conditions that are not well taken care of can
Okay.
also affect fertility.
All right. So, when should a woman consider having a fertility assessment? Is there something?
Anytime she considers the fact that the thought is there, she should have that discussion. Then again, for women about late 20s, early 30s
Early
is
30s,
a
mid
good time to
30s.
have that discussion with your specialist.
So, what information can fertility testing provide?
A whole lot. It can fertility is also a mirror of your whole body. Yeah, so
That's
fertility
true.
testing will tell you about the tubal fertility, woman's hormonal status,
Mhm.
regular periods, is she ovulating, are the tubes blocked,
Okay.
the semen analysis, is it normal? So it tells you everything. Even it can tell you if there are scar tissues in the in the pelvis. Pelvis is like a bowl that where the reproductive organs sit, the
Okay.
tubes, the uterus, the ovaries. So it
Okay.
tells you if there are so when I say pelvis, I mean like if there are adhesions like scar tissues with these structures holding on to themselves and not moving freely to pick the egg. So it tells you a whole lot. Even chronic infections like collections and all would be can be detected from um, fertility evaluation.
Okay.
Yes.
So the whole evaluation is like blood tests,
Blood
scans.
tests, you can do ultrasound scans, you can pick growths like fibroids, abnormal cysts, you can
Mhm.
do tests like hysteroscopy, looking into the womb for scar tissues and
Okay.
others. Like laparoscopy also helps see what is in the pelvis, what's going on, how the organs are formed, if there are scar tissues, and all of that.
Okay.
So, fertility evaluation would give a whole lot.
Oh, okay. All right. Thank you so much. So, how does fertility preservation fit into the modern reproductive health care?
Yeah, so fertility preservation is now the world is moving in a very rapid rate, and
Yes, ma'am.
so for the career woman, the woman that wants to, yes, egg preservation is very important, is something a lot of women should look into.
Okay.
Yeah, so it's something that would help take away the panic and the fears at the when you are ready for your children, because these eggs can be frozen for as long as you want them. Yes, even
All
more
right.
than 10 years.
Okay. So, are there any side effects associated with this egg retrieval and freezing? Are there any side effects?
Uh, Um, Not a lot, but
Okay.
for you to do the egg freezing and retrieval, you need to stimulate the ovaries to get the eggs. Now, those complications that can arise from excessively stimulated eggs, like what we call the ovarian hyperstimulation, can be there.
Okay.
Yes, the women can have pain, they can bleed,
Okay.
and the process is you harvest the eggs through a means. It can get infected with
Oh,
some collection, but these complications are significantly they're minimal, because of course with expertise and the right
okay.
preparation, patient selection, a lot of these are
Okay.
not commonly seen.
Okay. So should women feel pressured or fearful because of age-related fertility discussions?
No, women should not. Women should be hopeful. Women should keep doing their thing. It's just a discussion to create awareness and let women know these things exist. But you can, women can have their children, like we keep saying, can get pregnant, can have families even after 35. So no one should feel pressured. This is just for awareness and also help women plan better, making informed decisions.
Right. What would you say to a woman in her early 30s who is concerned about her future fertility?
As you should see a gynecologist, they have a discussion, then with regular interaction, follow-ups, um, she'll be fine. So she should be hopeful. There is no cause for alarm or panic. It's just for people to know that this age-associated fertility decline is something that should be looked into, and
Okay.
not just for the women and for the men too.
All right. Thank you. So, what would you say to a woman who is over 35, like way over 35, and she still hopes to have children in the future?
So yes, so there are fertility treatment options that she can have. So over 35, she can get pregnant on her own. She can get pregnant and have children even after 35. So she should remain hopeful.
Yes.
Then there are also, because she's over 35, and we have explained that there's age associated decline in air quality and quantity. If she has tried over 6 months and she's not getting the results she expects, it's a good time to come for an evaluation and so the problems. for the delayed fertility conception rate will be treated. And
Okay.
if it's something that you would need also fertility treatment, other forms of fertility treatment, those will be
Yes.
offered. And the results will be, because the treatment you can get pregnant, and with fertility treatment a lot of women too have been getting pregnant, and also increasing the hopes for a lot of families. Yeah.
Yes, that's true. All right. If everyone watching today could take one message from this discussion, what would you want it to be?
Okay, so your fertility is your right. It's a mirror to your body. But every woman should stay hopeful. Over 35 is not a sentence to you cannot have a child. A lot of women can have children after then, but you
Mm-hmm.
should be knowledge. You should get the knowledge to. You should be informed enough to seek help and ask questions and go for your fertility checkups, as those are the things that help prepare you and arm you for the decisions you will take and get you prepared for the future when you're ready to have children.
Hmm. All right. Okay. Thank you, Dr. Jane. So I think this will be the last question for today. What is the most important fertility conversation women should start having with themselves and their healthcare providers?
Okay, so good question. They should start asking, what are my fertility options? Are there going to
Okay.
be challenges? Are there things I should look out for? How should I prepare for when for getting pregnant and all those? What should I or what do I need to know if pregnancy becomes or fertility becomes a challenge in the future and all of that? Those are the things the women should be prepared for, so they know what to do before they get to a point, and
Yes.
even when they get there, what can be done to get past a problem.
Okay. Thank you so much, Dr. Jean. It was a very, very insightful session. Thank you. And thank you to all our viewers for sticking around till the very end. I think it's safe to say that a lot of us learned something new because I definitely did. Thank you for sticking to the very end. I hope it was as impactful to you as it was to me. So do well to like, do well to subscribe. Don't forget to catch us on Wednesdays and Fridays. The time remains 3 p.m. You can catch us on Facebook, YouTube, Instagram, and TikTok. So thank you so much for joining us once more. Do enjoy the rest of your day. Bye.